During type 1 diabetes, the immune system attacks the insulin-producing beta cells in the pancreas, making the type 1 diabetic unable to digest glucose. Hyperglycemia occurs when blood sugar levels are too high. People with diabetes can develop this when they do not manage or treat their diabetes properly. A treatment for hyperglycemia is insulin. Some other things you can do is follow a healthy diet and exercise regularly. Hyperglycemia occurs when blood sugar levels are too high. People with diabetes can develop this when they don't manage or treat their diabetes properly. A treatment for hyperglycemia is insulin. Possible explanations of how Anna could have ended up with hyperglycemia is that her insulin was either expired or it was tampered with by heating it up and denaturing it. So she thought she was taking her insulin, but it really was doing nothing.
Immediate signs of hyperglycemia are increased thirst, headaches, blurred vision, weight loss, high blood sugar, trouble concentrating, and frequent urination. Hyperglycemia is having more glucose and a high blood sugar. Osmosis causes your cells to become dehydrated. Therefore, because of the overpowering amount of glucose, they experience frequent urination. The cells are dehydrated and they start pulling water out of places such as the eyes. When the water is pulled from the eyes, this causes blurry vision. The body also isn't getting the nutrients it needs because of this. It starts taking nutrients from your stored fats, which causes weight loss.
Retinopathy is any damage to the retina of the eyes. This is caused by excess glucose causing dehydration of the blood cells, which causes water to be pulled from the eyes for the blood cells, which is retinopathy. This can lead to blurred vision. Neuropathy is a general disease or malfunction of the nerves. High blood sugar levels cause leaky blood vessels, which cause nerve damage, which is what neuropathy is. This reduces sensations in the feet, resulting in ulcers or infections, which ultimately lead to amputations. Another result of neuropathy is urinary tract infections, or UTIs. This is paralysis of the bladder. When the nerves of the bladder no longer respond to normal pressure, the bladder fills with urine, causing UTIs. A third complication of diabetes is atherosclerosis. During atherosclerosis, arteries are characterized by the deposition of plaques and fatty material on the inner walls. Plaque forms when cholesterol lodges in the walls of the arteries. To fight back, the body sends white blood cells to trap the cholesterol, which then turns into foamy cells that ooze more fat and cause more inflammation. That triggers muscle cells in the artery wall to multiply and form a cap over the area. This can also result in blood clots if the blood vessel feeds to the heart. It can cause strokes if the blood vessel leads to the brain. The last one is disease of the kidneys, nephropathy. This is high blood glucose levels, which cause leaky blood vessels that cause damage to the units that clean the blood.
Anna's hyperglycemia could have very well been an accident in many different ways. 3 ways her death could have been an accident resulting from hyperglycemia. She could have injected not enough insulin by miscounting her carb and glucose counts. Her A1C test showed that she was managing her diabetes well, therefore she was probably taking insulin, but the wrong amount. This picture shows too much glucose. Another reason for this may have been stress from an illness or experience. She was telling her sister she was scared, and she also went through a divorce and a breakup. She might have been under some stress. When you're stressed, your blood pressure is higher. A third reason may have been that her insulin could have been expired and not been doing anything for her. Again, her A1C test showed that she was taking insulin, but her glucose levels were high, so her insulin may have been expired.
Anna's hyperglycemia could be a result of foul play because if somebody knew she had type 1 diabetes, they would know she needed insulin to keep her blood sugar at a normal level. Insulin needs to be kept in a colder temperature, so if it was heated up, it would denature it, making it unable to do its job at managing sugar levels. After denaturing it, Anna would continue to use that insulin, thinking it was working, but in reality, it was doing nothing because it was denatured, then causing hyperglycemia. Three specific ways someone could have involved in replacing the insulin was with water, heating it up and denaturing it, or taking her insulin completely so that she was unable to access it, making it look like an accident or a natural manner. Evidence from this case that supports these theories is she was managing her diabetes well.
Hyperglycemia can cause a stroke, atherosclerosis. A stroke is a part of the brain not getting enough blood supply, oxygen, and nutrients. Therefore, that part of the brain dies. Then, brain cells begin to die as well.
Attack
Also known as atherosclerosis.
occurs when a coronary artery that provides the blood to the heart muscles is blocked. High glucose at the time of a heart attack could make this block worse by causing the blood vessels to contract.
Hyperglycemia can occur when diabetes isn't even a factor. It may happen suddenly during a major illness or an injury. It is proven that Anna Garcia had some kind of injury because she had a pool of blood by the side of her head, which could have caused hyperglycemia.